Hello, I'm Matthew Weinstock with Hospitals and Health Networks. As the healthcare landscape continues to evolve, hospital leaders must figure out how to push their organizations forward, but do so without jeopardizing finances and operations in the present. Susan Starling, President and CEO of Marcum and Wallace Memorial Hospital, a critical access hospital in Irvine, Kentucky, seems to have done just that. Starling has spent 30 years at the hospital, taking over as CEO in 2001. Since that time, the hospital has embarked on a number of community health initiatives. Starling was a 2013 recipient of the Shirley and Monroe Leadership Award, handed out annually by the American Hospital Association to an outstanding rural hospital leader. Susan joins me now. Susan, thanks for being with me today, and congratulations on your Shirley and Monroe Leadership Award. That's quite an accomplishment for a rural CEO to get that award, isn't it?
Yes, it is. It's really just not about me, it's about my leadership team, and I thought I wanted to add that to the Shirley Monroe Leadership Team Award because it's the team that helps me it makes me look so good, having such a great staff at home at the hospital working towards making our community better.
Can you give us a sense of your market, your demographics, and the hospital itself? What's the makeup like?
Well, the county that I live in is 15,000, and we also service 3 other counties to the east of us that are very small and rural. The 3 counties that are to the east of us do not have hospitals, so our critical access hospital services those 3 counties. Probably 70% of our population that we serve in our hospital have either Medicaid, Medicare, or Medicaid.
So Susan, you've done a lot in the hospital to reach out to the community and do some community health programs, the lung assessment program and some others. Can you talk about some of the highlights of those programs and what you've achieved?
Most of the programs that we've done in the community have been programs that we have reached out to the poor or the underserved, looking for the uninsured patients that maybe not have access to health care. We've been very fortunate to be the recipient of the outreach grant and the network grant that is from HRSA. So from these programs, we've just built networks and we've built relationships with people. So the most exciting one that just recently we've implemented was the lung screening for high-risk patients. So we're looking at patients who are uninsured and don't have access to health care that would be high risk for lung cancer. We're partnering with the University of Kentucky Marcum Cancer Center. So we were able to fund the screenings. So we're doing the CT screenings at our facility, and then if the patient is positive, then we can connect them with a service and they can actually follow up with medical care at the Marcum Cancer Center. And this is such a great partnership because at times when you have grant funding, you either have the ability to provide them with some service or the screenings, but it's hard to get the two together. So we were successful in getting the screenings done, which Marcum Cancer Center was looking for somebody to support that, and then we were looking for somebody that would be able to take care of that patient if we did have a positive. And other programs that we reached out for mammography, looking for the patients that maybe are uninsured or don't have access to care, and we've found patients that had they not had a mammography performed at our facility that they would have not had the test and they were positive for breast cancer. Not only were we able to provide them with the screening, we can partner with someone to provide them with follow-up care. So after surgery, when they get back home, that we connect with them again to make sure that they are able to get the help that they need for prostheses and any other care that they would need for follow-up. We provide transportation, so many of the patients don't have access to health care because we're limited. We have no public transportation in our community.
So Susan, as the healthcare landscape evolves to more risk-based contracting, accountable care structures, value-based purchasing, things of that nature, where do you see Marcum fitting into that equation? Is that a movement you think you're going to be going down towards more risk-based contracting?
I don't think that we'll be able to because we're small and our whole foundation is primary care. So my goal as a critical access hospital in the area that I'm in is just to build a strong footprint for primary care services. If I can do that, then I think that I can be attractive to someone who wanted to start an ACO or be a part of a clinically integrated network.
And then in terms of your primary care network that you were talking about, how many physicians are on your staff? How many of you decided to employ versus affiliated?
We have 10 physicians who we've employed. We've employed both primary care physicians along with nurse practitioners, and we have 3 provider-based rural health clinics without in the communities. We have 2 in our primary market area and then 1 in our secondary market area.
Given the success you've had with some of your outreach programs, with your primary care network you've developed, as you look to and talk to your peers at critical access hospitals who may be sort of feeling their way through the changing landscape, what's your message to them? What are the 2 or 3 things they need to consider as they decide? Do we stay independent? Do we focus on, a primary care service versus something else? What do they really need to focus in on?
Do your homework. Know your community. What are your needs? Who are your partners? Your success in a rural community is about developing partnerships and relationships with people. Marcum Wallace Hospital cannot work alone. I have to have partnerships with the other healthcare providers within our community.
Well, great, Susan. I appreciate your time today.
You're welcome. It's been a pleasure.
And I'm Matthew Weinstock with H&H Daily. Thanks for tuning in.